All right, thanks for coming today. We appreciate you all being here. We're going to talk about don't risk patient safety with slow medical record indexing today. This is part one of a series of three webinars that we're going to be presenting to you to provide you information on this troublesome workflow that we've discovered, and hopefully we're going to help you solve it if it's a problem for you. So with me today, by the way, is Natalie Galata. Natalie is our Director of Client Experience here at Disc Corporation. And besides being a former client, which helps her direct our client experience, she also has walked in your shoes in a lot of ways. She's run both operations and IT for a large ambulatory system in Chicago for a long period of time. And so she knows about these types of things that you see on a day-to-day basis. And so we brought her here today to help share her experience with you. Along with me, my name is Casey Frank. I'm EVP here at DISC, and I'll be your host. I'll be running through this 20-minute presentation with you. And wanted to let you know ahead of time that we are going to send you the presentation after, so there's no need to write a bunch of stuff down. Again, wanted to say thanks. I know you're probably double booked right now, like you usually are. And so we appreciate you taking the time with us instead of somewhere else. All right, so let's get into this agenda. What we're talking about today, again, is slow medical record indexing and the impact on your organization from really this tedious, time-consuming workflow that bottlenecks the process of getting information into your patient records. So we'll be talking about the problem. We'll be talking about why it's happening, who thinks it's a problem besides us and our clients, and then what you can do about it if you notice a problem within your organization. So let's jump in. First, we're talking about the medical record indexing workflow. So if you're not familiar with this workflow, one simple way to describe it is how you receive and enter fax documents into your electronic medical record. As you probably know, if you're attending this session, medical record indexing occurs when you receive a non-interface document, like a fax document or a scan document, let's say, and you need to enter it into the patient record in your EMR, whether it's Epic or Allscripts or NextGen or Greenway or whatever EMR you're on. That documentation is coming in non-interfaced and requires what's called indexing. Some folks call it filing. We call it indexing, but you'll hear those words used for this procedure that we're going to talk through. And you're going to see it happening really a lot with fax documents, paper documents, maybe even internal forms that you're using within the organization there, but any non-interface document really. So we're going to jump in and we're going to talk about when you are starting to notice problems that may be related to indexing. And this is really where we get into Natalie's expertise. We can talk about it all day long, and we certainly have talked about this with a lot of folks over the 70 years we've been in business, but nobody's lived it like you have, and nobody's seen the things that you have sitting where you sit. So we're going to talk about this a little bit here. So the first big sign of trouble that you may notice if you're having an indexing problem, and really it's slow indexing is what we're talking about today, is that documents are piled up in your, let's say, batch filing area within your electronic medical record. So if you're, for instance, if you're on Epic, you might notice a big pile of unindexed documents in OnBase. Or if you're on Allscripts, you may notice that same big batch of documents sitting in the batch filing queue, which they call the batch basket. In ADM or in NextGen, it may be in ICS. You see these big piles of documents and they're older than 24 hours old. That's a problem. That means that these documents are not in your patient record. They have not been sent to, for instance, a provider for review, and certainly there's been no follow-up to the patient. And so those documents are kind of stuck. They're orphaned there. So if you're seeing this happen, you know you're seeing signs of trouble. Are you receiving complaints, right? Misfiled documents, documents filed to the wrong place. Could be that the provider goes to look up a patient document, it's not there, or maybe it was sent to the wrong patient record, or maybe it's just in the wrong place. It was misfiled to the wrong document type. And so now the provider doesn't receive it in their queue. They don't follow up with the patient, or they're searching for documents while they're with the patient or on the phone with the patient. It can cause a lot of problems. So if you're hearing about misfiled documents, then most likely you have some trouble there. You may also simply have trouble spots, right? those spots that for whatever reason just can't get this process right. It could be a couple locations that you have where maybe they just have some form of poor management going on, or they're missing staff, or they have staff out on leave, or something of that nature. Or you have a troubled workflow. Maybe it's like a local hospital that you're not interfaced with. And so they send you all these PDFs and you're getting them all and you don't know what to do with them. How do you get them all into the system? And so that's a problem for you every day. So you may have trouble spots like that. So those are the kind of things that if you start to see, then you really ought to start looking into this problem within your organization to see maybe if you really do have a more severe situation. Now, what I wanted to do now is tap into Natalie's experience. So again, I appreciate you being here, Natalie. We're dragging you away from our clients for a moment here. Really, I was hoping you could dive in and talk through some of these scenarios that we know organizations are facing. You've seen before, whether it was in places you've been, worked, colleagues that you've worked with over the years. Talk us through some of these scenarios, if you would.
Yeah, sure. So as Casey said, I have been in healthcare for over 20 years. I have been in your shoes. I've been in the clinics and worked in leadership. So I can tell you the effect that getting records into the chart has the impact on the organization. It impacts the provider, it impacts the patient, and it impacts patient care. And that's what we're going to talk about a little bit today. So we've all know or have been that patient that is waiting for our lab results or biopsy results to come back. And it's nerve-wracking. You're worried, you don't know what's going on. And it could be because the provider is waiting for this document to get to him, tasked to him from within the EMR, and then the provider's got to look at it. And then the provider will contact you. Well, I don't know about you, but as a patient, I'm picking up the phone and I'm calling the office. Now your office staff is picking up the phone, trying to tell that patient, we'll get with you as soon as we get the information. So it causes a lot of anxiety. It impacts, like I said, the patient and your staff. And so that's one of the things that indexing slow can cause. Another thing that comes up, unfortunately, in our busy clinics where we've got patients in front of us and the phone's ringing and we've got to get to Dr. X and what he needs, we're trying to also have our staff index these documents during their busy day. And sometimes accidents happen, they get the wrong patient information in the chart. And now what happens in the day and age of patient portal, your patient portal proactively contacts your patient and says, you have a document in your portal that you should go look at. So the patient does, and it's the wrong patient's information. Now you have HIPAA concerns as an organization. Again, the patient's probably picking up the phone and calling your office, but there's also the patient who didn't get the information in their chart. So now that patient doesn't have what they're looking for as well. So that causes some concerns there. In my past, we had certain treatments that providers could only give to patients during certain small windows of their disease state. And in those instances, it's critical that these providers get information, lab results, study results, as urgently as possible to ensure that their patients get the treatment that they need in that small window of time for which they qualify. If those providers don't receive that information due to slow indexing or other issues with indexing, that patient might miss that window and not be able to receive those treatments. And as what would happen in your offices and my office, now we're in a world where we do a lot of data analytics, clinical studies, and leadership wants reports, and an enterprise environment where you've got multiple offices. In my past life, I had 34 offices I was looking over. And in 34 offices, you could have 70 people that were scanning in documents. It's very difficult to get them all to scan those in the exact same way, in the exact same folder. And now you're the clinical research person, and you need to get all of the patient consents for clinical research. And you have to pull that data out of your EMR because you can't go to 34 offices and get it. So it's very challenging for leadership and for research teams, clinical analytics teams, if we have inconsistent filing throughout the organization.
Makes
The long
sense.
and the long and the short of it really is, our staffs are working hard out there. No,
They're taxed,
they're
right?
taxed.
They're taxed.
They got patients coming in, phone calls to take, and then we're adding one more thing onto them, which is a really important thing for an organization.
It makes it rough. I appreciate you sharing that, because it actually leads into what I was going to show next, which is what are they doing when they're indexing or filing, and why is it so difficult? Why is it really such a problem? I don't think people understand necessarily. They may hear the process, but when you actually look at what it takes to do this process every day, if you've got, for every 100 providers that you have in your organization, you're receiving typically about 500,000 pages of unfiled documents per year. That's per 100 providers. So if you have 1,000 providers in your organization, you have 5 million pages of this stuff. And so what do you have to do with it when it comes in? Just a quick 1-minute overview on what indexing really is and what it entails. If I receive a fax lab result into my system and I'm indexing it right now, the first thing I'm doing is attaching it to a patient so that I know that I can send it into that patient record. Well, how do I do that? A series of clicks. And these clicks, by the way, happen at a rate of between 30 and 50 clicks per document at least. So when you're talking millions of documents per year and you're talking dozens of clicks per document, you're talking tens of millions or hundreds of millions of clicks per year in your organization to do this process. It's intense. When it starts with patient matching, your staff members looking at the document, they're keying into a box, either a patient name or a date of birth, and they're pulling up a list from the EMR and they're scrolling and finding the patient and clicking. And so you're looking at the document, you're typing information, you're scrolling and you're clicking, all just to do one of the required elements for that document. Usually there's 4 or 5 required elements for that document. So for instance, document type. Document type is going to be that name of the document, such as lab result. Well, you have hundreds of document types. I am the person doing the indexing. As Natalie said, there may be 70, there may be 100, there may be 200 people doing this around your organization. I am remembering out of your 150 document types that I'm now looking at a lab result. I'm going to start typing that in, or I'm going to scroll and click it. And now I have done 2 of the 4 or 5 required data elements. Now I look for a provider on the document. You see where I'm going with this, right? So I look for a provider on the document. Oh, it's not on the first page. Maybe it's on the second page. Maybe it's on the, oh, here it is on page 3. Let me go back to our provider list, select that, scroll. Okay, I've got the provider. So now they can review the document. And now I'm almost done. Now I need to maybe enter in a date. Let's say the date of service. So let me find that on the document. Let me type that in. I just did that for one document. You have millions of these per year. This is what happens when they're doing the filing and the indexing process. So the cause and effect is pretty great on this. When you have millions of clicks like this, what you really end up with is a much higher rate of error than you expect. Again, millions of clicks leads to lots of errors. Even if you're a person that does this every day, you cannot do this at 100% accuracy. You will create errors. It's just a part of the sheer numbers of it all. We're humans, we make mistakes. As Natalie said, we might be doing 5 other things at the time we're also trying to index a document. It becomes very, very difficult. Then you're also dealing with the complex filing rules that may even change from document type to document type. And so I'm trying to remember that as I'm doing this 1 page at a time, over and over and over. Should I send a document to the provider? Should I not? Oops, I forgot this time. Okay, well, what happens? Well, the provider doesn't review the document, right? So again, you're trying to remember all of these rules associated with hundreds of document types. Certainly leads to burnout with all the clicking. I don't think I need to dwell on that. I think everybody realizes when you're clicking all day long, it leads to burnout. We know we're having trouble right now with staffing. So the last thing you want to do is burn out your staff right now. It's hard to find more staff, right? So this is happening across the industry. As you know, people are leaving when they're tired of their job, and a monotonous day of processing, indexing, documents can be rough on the psyche. So again, these are things that you have to be thinking about, the cause and effect of doing 10 million clicks a year, 100 million clicks a year, 200 million clicks a year. So we're not really the only ones talking about this. Obviously, our clients are solving this problem with us. Everybody really across the industry is now starting to realize this is a problem. you're seeing, ECRI, for instance, as you probably know, they release their top 10 patient safety concerns every year. And every year you'll see a reference to this, whether it's outside records processing, right? Because all of your outside records come in through fax. So if you don't process them appropriately, it leads to a lot of these issues we've been talking about. You've seen that mentioned multiple times on ECRI's top 10 list. You now see if you're going to go for stage 7, complete EMR through HIMSS, which a lot of you are, you have to get your documents filed within 24 hours. That's a requirement. So again, you have organizations like HIMSS saying, this is important. You need to do this. It isn't just DISC. Now, we do have solutions to solve these problems. We're not here really to talk about that, but just to give you a general feel, especially as we flow into the third webinar where we're talking about specific use cases with our clients, we can solve this problem, whether it's a fax to EHR problem or a paper to EHR problem. If you have any questions about our solutions, you can pop into our website, take a look at that. I think what you're starting to see, though, overall is our focus is on lowering the risk and really lowering the risk for you for patient safety concerns that you have, right? Not getting information into the right hands at the right time. And so we help our clients standardize and improve those processes that, at the end of the day, they improve patient satisfaction, right? If your patients aren't waiting for 5 days to get their results back from a lab that sent it to you in 24 hours, they'll be happy about that rather than waiting for numerous days, as Natalie alluded to. Eventually, you start calling as a patient. So we're looking to improve patient satisfaction with our solutions. And then, as we talked about, these kinds of workflows are tough on your employees. They really are. They're tedious. They take a lot of time. They suck out a lot of energy. Especially processes that you don't like, that you have to do every single day, and they have to be done on time every single day. So this just gives you the ability to free them up and allow them to do other things that are more valuable to your patient, maybe even more patient-facing stuff, things that they prefer rather than the click-intensive workflow, the indexing workflows. So, Natalie, appreciate you joining us today and sharing what you shared. Always great to get your experiences from, as we say, back in the day as a client and really, working within a client organization of ours. We talked a little bit about this being a 3-webinar series. So this is the first, as we talked about, not risking patient safety with slow medical record indexing, but we're going to dive in on the next webinar and really show you how you can audit. So if after hearing this, you're thinking, gosh, some of those things are actually happening in our organization. I've heard about that. I've seen that. I want to know more about that. The next step is sitting through our How to Audit webinar. We're going to show you in 20 minutes how to do a quick audit to really know whether you have a problem or not. And that will be coming up next. And then the third and final installment will be to talk about some of the use cases. How do we solve these problems? We've had clients who have found these problems and then solve them with our solution. So we're going to walk through 3 of those examples on that final webinar. So again, I really appreciate your time. Again, my name's Casey Frank. I'm with DISC. Natalie Galata with DISC. We appreciate it, and we're looking forward to talking to you again. Thanks.